Doctors of Reddit, what happened when you diagnosed a COVID-19 Denier with COVID-19? Obligatory, not a doctor, but I am an ER nurse. We had a guy come in with what he thought was bronchitis. Asked for the test just to calm his family down. His chest x-ray showed COVID pneumonia, and his test came back positive. First it was I'm going to need to know my test results before I believe it. Then it was I need to see the test results because you can say anything. He refused admission and left AMA, and as if trying to say the most ridiculous thing he could think of, said and I won't be telling my family because I just don't believe this. He returned 2 days later, oxygen saturation in the 70s. He spent about a week in the ICU, intubated, before dying. ICU nurse here, 6 years. Dealt with COVID since March 2020, actually had the first confirmed PT at our hospital. November-February was rough. I had a 2-week streak where every day 1 or 2 of my patients would die. We'd go up to 3 or 4 patient assignments. The norm is 2, 1 or 1 if on certain equipment. Most all of the patients understood the severity of what they had. A handful didn't believe they had COVID, even though removing high-flow O2 or their BIPAP would put their SATs down into the 60s or 70s. Many had comorbidities that put them at risk: cough, asthma, obesity, sleep apnea, smoking. I think people would refuse to be intubated because they knew what the outcome would be. Fight, hope, pray, fingers crossed, whatever you want to call it, delaying the inevitable. Our ICU attending would actually have them sign consent for intubation, if they were cognizant enough to do so. Almost all of them died. Very few made it out alive but still so sick and debilitated, some with trachas. One guy in particular sticks out. This was right after Christmas. 21 years old, HXDM1, obesity, sleep apnea, didn't like to take his insulin. Admitted with COVID. Didn't believe he had it. Should have been tubed days before but refused, then he ended up being intubated emergently. Took about 5 of us to prone him, lay him on his stomach, because his O2 sats were in the 60s. Couldn't get to pulse, noticed no waveform on the art line. Had to flip him back over to do CPR for about an hour or so before we called it. Had a kid and a fiancé. Honestly, it was more of the families that denied their loved one had COVID. Upset, understandably, about not being able to visit. Zoom calls just don't cut it. I say this all as my parents, Mom SD and Dad SM, are all COVID deniers, even when I tell them what it's like. Well, these people had other things wrong with them though. They were older, they tell me. They send me links about all the conspiracy theories re-COVID. I got the Moderna in December and January, still haven't told them. It's awful. The facial swelling alone from being prone is enough to give a person nightmares. Watching someone go into multi-system organ failure, needing dialysis, unable to put them back onto their back, being maxed out on ventilator settings and it still not being enough to the point of barotrauma and collapsing a lung and needing a chest tube to re-inflate it. Families saying do everything even though they had coded once or twice. Hearing families on Zoom crying, praying, singing as the patient is intubated, sedated, and paralyzed so the ventilator can do the work. Tearing up under all the PPE because yeah, we are still human. We work so hard and sometimes it doesn't fucking matter. But we go back, day after day. I wish people who don't believe could see what I have seen. It might scare them enough to take precautions seriously and get the vaccine. ICU COVID ICU charge nurse here. Had a woman try leaving the ER against medical advice with COVID and was needing tons of O2. Our docs convinced her to get admitted. My wife was her ER nurse and brought her up to me. Patient was yelling and screaming, ripping off her mask, spitting and telling us we're all sheep between gasping for breath. Our docs told her she was close to needing to be intubated, breathing tube, and she just scoffed. We reached out to the husband who proceeded to swear and berate us, telling us we're keeping her prisoner, no visitors in our COVID unit, and that we can do whatever we need because none of this is real and it's all for show so you guys can get paid. She gets intubated, decompensates over the next few days, and finally codes. We code, perform CPR, give medications, defibrillate, etc. her for well over 1.5 hours before calling her time of death. The kicker was calling her husband and getting absolutely excoriated because we injected her with COVID as an experiment and killed her. He then had to be escorted out of the hospital when he came in to try getting up to the unit, without a mask, of course. This shit's getting exhausting. One story stands out. Last summer a guy came to the ED with symptoms and tested positive. He refused admission for the classic list of reasons. It's a complete hoax, and even if it's not a complete hoax it's not that big a deal, I'm strong enough, etc. Couple days later he was back in the ED with his mom, who he lived with and who was now also symptomatic. They were both admitted and eventually put on ventilators. Guy lived, but his mom didn't. ER doctor here. I diagnose people with COVID on the daily. Some people are actually really great about it, others are more difficult. I'll tell you a tale that occurred during my most recent shift. Back-to-back rooms and patients. Patient A, in room number 4, is a 23-year-old Malay, no medical history, comes in with body aches, malaise, and fatigue. Also had some mild nausea without abdominal pain or vomiting. Patient B, in room number 5, is a 51-year-old female, medical history of intermittent asthma, so she uses a puffer infrequently, comes in with shortness of breath, has some possible fevers at home. In triage it was noted that this patient's oxygen sats were in the 88 range and her heart rate wasn't elevated. Interestingly, when asked if she thought she had COVID she said, "I can't have it. I tested negative 2 weeks ago when my son tested positive. He's been sick at home." You guessed it. Both people COVID+. Patient A went home. He's doing great. Was extremely remorseful, and before he even left the ED he called his work to let them know he was positive and to get everyone there tested because he figured he had gotten the illness at work. He worked in a small family-owned warehouse as a foreman. He also called his parents and they were getting him set up to sleep in the garage until his quarantine was up. I respected this guy. Patient B got admitted to the hospital because her O2 sats weren't great. When I went back to tell her she was COVID+, she called me a liar and told me I must have made a mistake. She threatened to sign out AMA, against medical advice, but when she got up to leave she got so short of breath the nurse used that to convince her to stay. People are strange sometimes. I try not to let stuff bother me, but COVID deniers come very close to crossing that line. NAD but an RN. I lost count of the number of patients I had who were COVID deniers, even right up until their last breath. During the peak in January an average shift had me spend an hour or two being cussed out by patient family members that COVID was fake, we can't keep them from seeing their family member. Then I'd spend the shift sweating like I was in Kuwait, running around trying to keep everyone as comfortable as possible and maintaining their O2 and often repeatedly having to put someone's oxygen back on after they insisted they didn't need it. Multiple times I got told we had it all wrong, that it was just a cold, or that they weren't that sick and didn't need oxygen even as they ran out of breath trying to get out a single word. Being in a super rural area, it was to be expected. We even had COVID-denying nurses for the longest time. Eventually they got the picture though and got with the program. Still, one of the worst that stuck with me wasn't the COVID-denying patient. Patient believed in COVID and was a super great person. They were old though and had a caretaker. Caretaker didn't believe in COVID and was strictly anti-mask. Upon the caretaker being diagnosed with it, they refused to wear a mask or quarantine and said it was fake. They kept taking care of the person and never told them of the diagnosis. That person wound up getting COVID and being admitted to us. Nurse here. I had COVID and now I'm in rehabilitation because my lungs are at 70% capacity. Now, I was at 40% capacity, and now when I hear someone say that, I have the urge to slap them with a chair. I will need another year until I'm fully recovered. Edit. I thank you all the kind words and the awards. You guys gals are awesome. My wife's a nurse, just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 15 minutes and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. I'm a doctor working in acute internal medicine. I've seen lots of COVID over the last 12 months, probably 300 plus cases. The one that sticks out in my mind the most was a 70-year-old lady with COVID. She refused to have a vaccine because she didn't trust it despite the fact she was eligible for one for weeks beforehand, in the UK. Subsequently caught COVID and was admitted to hospital. She repeatedly doubted this was the diagnosis. She refused to go to our COVID high dependency unit despite quite significant respiratory failure. Of course, she deteriorated over a number of days to the point where she was on maximal oxygen on the ward and at that point finally accepted treatment in HDU with high-flow oxygen, although continued to doubt she had COVID. Died within 24 hours of her HDU admission, having refused to go to ICU. And of course, what did her family say? They were convinced she never had COVID and even went as far as accusing us of withholding life-saving treatment from her. Unfortunately, there's no treatment for stupidity. Edit. Spelling. Not a doctor, but my wife is and a few of our family friends are as well. One of them is sports medicine family. The guy came and refused to use a mask. Our friend refused to treat him until he masked up. He had a newborn at the time too. When our friend told him he most likely has COVID, he needs to go to Tampa General immediately for testing and treatment. The guy said no, it's fake, he just needed some antibiotics. He left without getting a prescription, called back that night, demanded to be given oxygen. Our friend told him his only option was to go to the hospital. Guy had a severe case of COVID and ended up being hospitalized for a few weeks. He still thinks it was fake and was only a severe flu. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with care of fever and diarrhea. The child was severely dehydrated, and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband. He came with 10-15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. They just kept denying they had it, stated they had something else, and tried to leave against medical advice while on high-flow nasal cannula, which we didn't let him do because he would have died within minutes. Before he was admitted to the hospital, he was symptomatic but refused to isolate at home. He gave it to his wife, who ended up in the ICU. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspects positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. I'm an anesthesiologist, and in our institution, we're the ones tasked with intubating COVID suspects positive patients who would otherwise die without ventilatory support. And holy hell, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us, in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. Physician here. The willful cognitive dissonance is real. It never ceases to amaze me how many patients will refuse assistance from me to register to get vaccinated, make claims that vaccines are harmful, but then accept my medical care on anything else that suits their whim. Patients absolutely have autonomy to refuse care, but why would you continue to see a physician and accept their medical advice and care if you think they would simultaneously recommend something to you that would be harmful? I've posed this question to patients who are vaccine hesitant. Why would you let me manage your diabetes and hypertension if you think I would harm you by recommending vaccinations? You cannot get any kind of thoughtful response aside from, I just don't want to be vaccinated. My mom works for an OBGYN who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out AMA, but not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness. RN here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us, but honestly that happens frequently anyway. Some Denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. My uncle claimed he's take his chances with COVID during our masked, socially distanced Easter get-together at my grandmother's house, and that he was very hesitant to get vaccinated when many of my relatives have already gotten the vaccine and none of us have turned into 5G goons, only to test positive for the virus literally that evening. Ever since, he has been fighting for his life, and has seen the reality of the situation, and has finally agreed to be vaccinated once he recovers. It's shocking that it takes such an awful close encounter to turn people, and that others go to their grave having been deniers. Not a doctor, but when my grandmother was dying, my relatives kept pushing me and the doctors to say what it really was. It added so much stress to an already difficult situation and was embarrassing as well. Even after she died, they kept saying things like, "What if it was a stroke and she was misdiagnosed?" Don't you think they just didn't want to help her? I was trying to arrange with hospice to go in and say goodbye, and my stupid second cousin was sending me YouTube videos about how COVID is fake. I was already not close with these people and I am glad they are out of my life now. Not a doctor, but work in the psych area of the emergency department. Needless to say, there's a lot of psychiatric illness-based COVID denial and or paranoia. Patients often refuse swabs thinking we are trying to implant microchips. I only bring up my experience to contrast my psychiatrically unwell COVID-denying patients to the psychologically unfit COVID-denying population. One is because of brain chemical imbalances and the other due to propaganda, politicization, and poor critical thinking skills. It's interesting that the outcomes are similar, if only in this respect. Didn't diagnose a Denier, so not exactly this, but did have a patient refuse testing upon admission and aggressively yelling COVID is a hoax. I calmly said, "Okay. Nurse, since we won't know his status, please admit him to the COVID floor." He became a believer in an instant and requested to be tested. Edit, for those getting their pants into a twist over this. I work in a major city in the USA, and across our health system hospitals, we do our level best to not admit an untested patient to tested negative floor. Such patients, exposed refusing, are marked PUI, patient under investigation, and are admitted to another floor, with other PUIs. This floor also houses non-IQ tested COVID plus patients. All patients are kept separate from each other still, in private rooms. Hopefully this makes better sense and ensures that the general public doesn't think we are placing all patients into a petri dish of coronavirus. Edit 2, source, since this seems to not be obvious, and the story is unbelievable, am a physician, trauma surgeon, surgical critical care intensivist, and director of a surgical ICU that also functions as a COVID ICU during case spikes. Not a doctor, but nurse that worked in one of our COVID ICUs. Lady was intubated, sedated, proned, therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively. Reserved for very sick COVID patients, the whole shebang. Miraculously she recovers and is weaned down to high-flow nasal cannula, still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give meds care, simultaneously yelling that COVID isn't real, and that we gave her COVID. God, this winter sucked. I was hospitalized in the ICU for a while and wasn't far off from intubation myself. I was lucky and responded well to donor plasma and remdesivir and was able to recover surprisingly quickly once the pneumonia started clearing up. If it makes you feel any better, there are many more of us that considered you folks fucking troopers and incredible. I made sure to thank each and every one of you every time they came in, from the multiple blood pulls, attempts at least, before I got my midline, the multitude of breathing treatments and shots, to having to balance my giant 6 feet 5 inches ass to the bathroom once I was able to walk enough to piss in an actual toilet. You guys saved my life, and I'll never forget it. So, something to consider when the behavior of these shit stains wear you down. Edit, thanks for love, folks. One thing to add, the other thing that saved my life was quitting smoking 5 years prior to this. I weaned myself off with the vaporizer for about a year before dropping it entirely. Seriously, if you're smoking, quit, because it may bite you in the ass sooner than you think. Family members have come in with a sick family member and lied about exposure and or symptoms, despite a member's testing positive. This can lead to inappropriate management, delay in treatment, and exposure of staff and other families. The family members then get angry when told to isolate. Edit, typo. I have treated a young Malay in Araiku with critical COVID-19 with severe diabetic ketoacidosis. He did not believe in insulin, yes, you were reading this right, or other anti-diabetics, even though insulin is inexpensive in our country. He tried to treat his type 2 diabetes with herbs, his HbA1c, the lab value showing the state of his diabetes on the longer run, was off the roof. He did not vaccinate, he was offered, did not wear a mask, did not distance, and did not believe in any of this corona bullshit. Most of this information was obtained from his 20-year-old daughter, as he was quite disoriented at presentation and was intubated urgently. She was sobbing through the phone every day for 1.5 months until he died. I held the phone with his daughter on call to his ears multiple times when he was still intubated, but his mind cleared up and his sedation was optimal. I was quite convinced that he realized his mistake on the ventilator, with lines and tubes inserted into his body everywhere and in his last clear moments, when his mind allowed, but I cannot be absolutely sure. I often think about the last conversation and last mental images people have before their death. I'm an attending physician at our triage unit. On a Friday, an older gentleman, 6+ years, came in with his entire family, wife, sister, Bill, 2 newfs and 3 children, none of them with a face mask. All had mild COVID symptoms except him. He was saturating 80% with evident shortness of breath. We insisted in doing PCR and the chest CAT scan looking for COVID, but he and his wife refused, saying that COVID wasn't real and it was just a bacterial infection. The more we talked with him, the more agitated he got, to the point that his face was red. We suggested hospitalizing him to stabilize him and start treatment, but they accused us of exaggerating his symptoms and that we only wanted to hospitalize him so we could steal the liquid in his knees, a stupid rumor that was going around when this whole thing started. They both cursed at us and said they were going to a better hospital to get antibiotics. Fast forward 24 hours later on Saturday, we get a call from the hospital next county over telling us that they intubated one of our patients because he went into respiratory failure when he arrived and they had to transfer him here because they don't have the appropriate equipment. We transferred the patient on Sunday only to find out on the CAT scan he had 90% of lung damage. He passed away on Monday morning. Just before the family took the body away, I gave the widow the death certificate that I filled out, and before walking away, she turns around and waves the certificate yelling, "See? I told you it wasn't COVID. It says here, death due to pulmonary pneumonia due to SARS-CoV-2. I knew it was a bacteria, I told her, SARS-CoV-2 is COVID-19, Mom. Edit, because everyone's asking what happened afterwards, not much. She yelled, no, it's SARS. It's a bacteria. And stormed off. It's actually one of the mildest encounters I've had with a grieving widow. Not a doctor, but my cousin-in-law was a COVID denier. Went to his COVID denier girlfriend's family house for Thanksgiving without telling his parents that they were COVID deniers. He was living with his parents, my wife's aunt and uncle, since he had recently divorced his wife. Got back and found out a week later that the whole girlfriend's family tested positive. He got it. So his parents both got it. His mother was in treatment for breast cancer and his dad had asthma BTW, and they are not COVID deniers. His mother recovered, but his dad, my wife's uncle, went from coughing and wheezing the day after Christmas to the ER on New Year's Day. Within 24 hours after that he was put on a ventilator. 3 weeks later he passed. So yeah, my COVID denier cousin-in-law effectively killed my wife's uncle, and now that whole part of the family is really tense as his brothers kinda blame him for killing their dad, but their mom, wife's aunt, isn't willing to blame her son. Fuck COVID deniers. It's not really a joke. These assholes are literally killing people through gross negligence and idiocy. Infectious disease doctor here. Seen about 450-500 COVID patients in the hospital since it all started. Only one patient ever accused me of using the nasal swab to give him COVID, along with a microchip. A handful have, ranted nonstop about China. Everyone else has been sick enough to accept it, but lots still refuse the idea of vaccination even after being in the ICU. Edit. Lots of questions about vaccination after having the infection. Immunity after infection can last as little as 3 months. Immunity from vaccination lasts much longer and has the benefit of not putting you and those around you at risk. You can get the shot as soon as you recover and come out of isolation. No need to wait for 3 months. https://www.cdc.gov/2019-cov/vaccines/faq.html:/:text =no.com of the %20 criteria %20 before %20 getting %20 vaccinated. Edit. Change to immunity can last as little as 3 months. It can be longer depending on the person, but you can't predict ahead of time. I've got a patient in the hospital right now reinfected at the 4-month mark. I'm an ODP and work alongside anesthetists in theaters and ICU. To be honest, I've not really seen anything from patients regarding outright denial. However, I have seen some of my friends on Facebook who have spouted all sorts of lies. That's really disappointing to say the least. One of them, a friend of my wife, works at the hospital. She works in admin and refuses to wear a mask and even bought some certificate off the net so she doesn't have to wear one in public. Anyway, that's being escalated up the chain of disciplinary action. Medical spouse here. Husband works as a hospitalist in a rural hospital 1 week a month. He went to help in the RBC. They had patient that needed to be tubed who was COVID positive but didn't believe in COVID. The patient's oxygen level got below 70% or 60%, or whatever severely hypoxic is, so they told him he needed to be intubated. The patient screamed at my husband that he was lying and that if he tubed him he'd sue. Husband asked if he could do it if the guy stopped breathing and the dude said, well, that's different. So he waited 15 minutes for him to pass out from lack of oxygen and then intubated him and walked out. I was testing a guy yesterday who asked me if he still needed to be tested in order to be on a college campus even though he had received both doses PF Pfizer already. I said yes, it's a CDC mandate, and there isn't enough longitudinal study on the current vaccine's effectiveness on the variants to make a call on that yet. So we keep testing everyone once a week. Then he hits me with, you know, all this COVID crap is bullshit, right? Fucking government and Illuminati spooks trying to suppress us. I told him that 92 people have died of COVID under my care in the last 14 months, to keep his QAnon garbage to himself and to have a nice day. I got reprimanded this morning, lol. Most worth it slap on the wrist of my life. Edit. Hey, thanks for all the sweet Reddit clout. In lieu of any awards that may cost money, I would instead recommend that you donate to the Nurses House, which is a foundation that assists RNs struggling with mental and financial well-being. They do some great work. Thanks again.